Have you ever felt a sudden wave of dizziness wash over you, as if the world around you was spinning? Perhaps you experienced a fleeting moment of unsteadiness on your feet. This unsettling sensation, known as lightheadedness, is a surprisingly common experience. It can strike anyone, at any age, and often without warning. While usually harmless and temporary, understanding lightheadedness is crucial for differentiating between a benign episode and a sign of a more serious underlying condition. It can occur in various situations, upon standing up too quickly during a particularly warm day, or even after a heavy meal. Frequent or severe episodes of lightheadedness warrant a conversation with your doctor. Lightheadedness is a feeling of dizziness or unsteadiness, often described as a sensation of being disconnected from your surroundings. Unlike vertigo, which involves a distinct spinning sensation, lightheadedness is more of a feeling of impending loss of consciousness. This unsettling feeling arises when your brain temporarily doesn't receive sufficient blood flow. When this supply is momentarily disrupted or reduced, your brain sends out an alert signal in the form of lightheadedness. While the sensation itself can be alarming, it's important to remember that lightheadedness is usually a temporary and self-correcting phenomenon. Understanding the various factors that can trigger lightheadedness can help you manage and even prevent future episodes. The impact of lightheadedness extends beyond the momentary discomfort it causes. Depending on its severity and the situation in which it occurs, it can interfere with your daily activities and overall quality of life. Simple tasks, such as driving or walking, can become risky if you're experiencing a bout of lightheadedness. By addressing the root cause of your lightheadedness, you can regain control over your physical well-being and mental peace. One of the most frequent offenders behind lightheadedness is dehydration, a state where your body loses more fluids than it takes in. When this delicate balance is disrupted, your blood volume can drop, reducing the amount of blood reaching your brain. Hot weather, strenuous exercise, and even common illnesses like fever or diarrhea can lead to fluid loss. The good news is that dehydration-induced lightheadedness is usually easily remedied. Replenishing your fluids with water, electrolyte-rich drinks, or even juicy fruits and vegetables can help restore your body's hydration levels. By staying hydrated, you can minimize the risk of dehydration-related lightheadedness. Another crucial factor that can send your head spinning is blood sugar, the main source of energy for your body's cells. When your blood sugar levels dip too low, a condition known as hypoglycemia, your brain can experience an energy shortage, leading to lightheadedness. Several factors can contribute to low blood sugar, including skipping meals, strenuous exercise, and certain medications. People with diabetes are particularly susceptible to blood sugar fluctuations and may experience frequent episodes of lightheadedness. Consuming a quick source of sugar, such as fruit juice or candy, can provide your brain with the immediate energy boost it needs. For long-term management, maintaining a balanced diet and regular meal schedules can help keep blood sugar levels stable. Have you ever jumped out of bed too quickly and felt a sudden rush of dizziness? This common experience, known as orthostatic hypotension, occurs when your blood pressure temporarily drops upon standing up. Normally, your body compensates for this gravitational shift by constricting blood vessels and increasing your heart rate. However, in cases of orthostatic hypotension, this reflex mechanism is delayed or inadequate, leading to a temporary dip in blood pressure. Simple lifestyle modifications can often help manage orthostatic hypotension, such as staying hydrated and avoiding sudden postural changes. If these measures prove insufficient, your doctor may recommend compression stockings or medications to regulate blood pressure. While medications are intended to heal and improve our health, they can sometimes come with unintended side effects, and lightheadedness is no exception. Certain medications, particularly those that affect blood pressure, heart rhythm, or brain chemistry, can trigger bouts of dizziness. If you notice dizziness after starting a new medication or changing your dosage, inform your doctor. They can assess whether the medication is the culprit and adjust the dosage or explore alternative treatment options. Feeling faint, a harbinger of lightheadedness. It's a sensation of impending unconsciousness, a warning sign that your brain isn't receiving adequate blood flow. Your body, in its inherent wisdom, uses faintness as a protective mechanism. As your brain senses a dip in blood flow, it triggers responses aimed at restoring equilibrium. If you start feeling faint, find a safe place to sit or lie down immediately. This simple action can often prevent a full-blown fainting episode and give your body time to restore adequate blood flow to your brain. Dizziness, a common symptom of lightheadedness, can manifest in various ways. Some experience it as a fleeting sense of unsteadiness, like walking on a rocking boat. Others describe a more intense spinning sensation as if the world around them has been set in motion. Dizziness often stems from a mismatch between the information your brain receives from your inner ear and your eyes. When your brain is deprived of adequate blood flow, these signals can become scrambled, leading to a sense of dizziness. Recognizing the specific type of dizziness you're experiencing can provide valuable clues to your doctor and help guide diagnosis and treatment. Nausea, that queasy feeling in the pit of your stomach, often accompanies lightheadedness, adding another layer of discomfort to the experience. When your brain senses a dip in blood flow, it triggers physiological responses that can upset your stomach and lead to nausea. The dizziness itself can contribute to nausea by disrupting the balance of fluids in your inner ear. While nausea can be an extremely unpleasant sensation, it's essential to remember that it serves a protective purpose. If you're experiencing nausea alongside lightheadedness, it's best to rest, avoid heavy meals, and stay hydrated with small sips of water or clear fluids. This can help alleviate the discomfort and prevent further upset. Beyond the trio, recognizing other signs. While feeling faint, dizziness, and nausea often take center stage in the symphony of lightheadedness symptoms, they are not the only players. Blurred vision and ringing in the ears can also accompany this condition, providing further clues to its underlying cause. When blood flow is compromised, your vision can become blurry or hazy, like looking through a fogged-up window. Tinnitus, or ringing in the ears, can manifest as a high-pitched whine or a low-pitched hum. Paying attention to these subtler signs can provide a more complete picture of your condition and guide your doctor in making an accurate diagnosis. The diagnostic journey, unraveling the mystery. Diagnosing the root cause of lightheadedness is like embarking on a detective's investigation. Your doctor, armed with their medical expertise, becomes your guide, carefully gathering clues to unravel the mystery behind your dizzy spells. This journey often begins with a conversation, exploring your symptoms, medical history, and lifestyle habits. They'll want to know if your lightheadedness is a recent visitor or a longtime companion, if it strikes suddenly or gradually, and if any particular triggers set it off. By working together, you and your doctor can embark on a path towards diagnosis and ultimately relief from those unsettling dizzy spells. Medical history, piecing together the puzzle. Your medical history serves as a valuable roadmap for your doctor, guiding them through your past health experiences to identify potential contributors to your lightheadedness. During this part of the diagnostic process, your doctor will inquire about any pre-existing medical conditions you have, such as diabetes, heart disease, or thyroid disorders. They'll also ask about any medications you're currently taking, both prescription and over-the-counter, as certain medications can have side effects that include lightheadedness. Your doctor might also inquire about your lifestyle habits, including your diet, exercise routine, sleep patterns, and alcohol consumption. This information can help your doctor understand your current condition within the context of your overall health journey. Section 3. Physical examination. Listening to your body's story. Beyond the spoken word, your body itself whispers a tale of its own, revealing subtle clues to your overall health and well-being. During the physical examination, your doctor becomes a skilled interpreter of these whispers, using their senses of sight, touch, and sound to gather further insights into your lightheadedness. This hands-on assessment often begins with the basics, checking your blood pressure and heart rate. These vital signs provide a snapshot of your cardiovascular system's functioning and can hint at potential issues that might be contributing to your dizziness. Your doctor will likely take your blood pressure and heart rate both while you're lying down and after you stand up to assess how your body adjusts to postural changes. They might also gently press on specific areas of your neck to check the pulse in your carotid arteries, the major blood vessels supplying your brain. This helps them evaluate the strength and rhythm of blood flow to your head. Additionally, your doctor might examine your eyes, looking for any signs of involuntary eye movements or other abnormalities that could indicate an inner ear or neurological issue. Remember, your body is constantly communicating its status through subtle cues, and a thorough physical examination helps your doctor decipher these messages and gain a deeper understanding of your condition. Section 4. Tests and investigations. Delving deeper. Sometimes the clues gathered through conversation, medical history, and physical examination aren't sufficient to pinpoint the exact cause of your lightheadedness. In such cases, your doctor might recommend further tests and investigations to delve deeper into the labyrinth of your body's inner workings. These tests act as specialized tools, providing a more detailed glimpse into your body's systems and helping your doctor rule out certain conditions or confirm their suspicions. One common test is an electrocardiogram, or EKG, which records your heart's electrical activity. This painless and non-invasive procedure helps your doctor identify any irregularities in your heart rhythm that might be contributing to your lightheadedness. Depending on your specific symptoms and medical history, your doctor might also recommend blood tests to check for anemia, diabetes, thyroid disorders, or other conditions that can manifest with lightheadedness. In some cases, imaging tests, such as a CT scan or MRI, might be necessary to rule out structural abnormalities in your brain or inner ear that could be causing your dizziness. Remember, while the prospect of undergoing tests can sometimes be daunting, these investigations play a crucial role in reaching an accurate diagnosis and guiding your treatment plan. By working collaboratively with your doctor and approaching these tests with a positive mindset, you're taking proactive steps toward understanding and managing your health. Section 1. Addressing the root cause, a tailored approach. Treating lightheadedness isn't about finding a one-size-fits-all solution. It's about addressing the root cause, the underlying trigger that's setting those dizzy spells in motion. Like a gardener tending to a wilting plant, your doctor will assess the specific needs of your condition and recommend a personalized treatment plan to restore balance and alleviate your symptoms. This tailored approach often begins with identifying and addressing any underlying medical conditions that might be contributing to your lightheadedness. If diabetes is the culprit, for example, managing your blood sugar levels through diet, exercise, and medication becomes paramount. Similarly, if an irregular heartbeat is the source of your dizziness, medications to regulate your heart rhythm or procedures to correct the underlying electrical abnormality might be necessary. In cases where medications are identified as the trigger, your doctor might adjust the dosage, explore alternative medications, or recommend strategies to minimize side effects. For instance, if a blood pressure medication is causing your lightheadedness upon standing, your doctor might suggest taking it at bedtime or adjusting the dosage to reduce the likelihood of a sudden drop in blood pressure. Remember, your treatment plan is a collaborative effort between you and your doctor. Openly communicating your concerns, asking questions about your treatment options, and actively participating in your care can significantly impact the effectiveness of your treatment and pave the way for a smoother recovery. Section 2. Lifestyle Modifications, Simple Yet Powerful Tools. Sometimes the most effective solutions lie in the simple choices we make daily. Lifestyle modifications can significantly impact our health and well-being. Staying hydrated is fundamental. Dehydration can cause dizzy spells. Sip water throughout the day, especially in hot weather or after activity. Pay attention to your diet. Balanced meals stabilize blood sugar levels. Regular exercise improves circulation and reduces lightheadedness. Section 3. Medications, allies in restoring balance. Medications can play a crucial role in restoring balance and alleviating lightheadedness. These pharmaceutical allies fine-tune your body's systems, addressing specific issues causing dizziness. For orthostatic hypotension, medications can regulate blood pressure and prevent dizzy spells. They often work by constricting blood vessels to maintain blood pressure. For inner ear disorders, medications control vertigo and alleviate nausea. They target balance centers in the brain or reduce inner ear fluid. For anxiety-related dizziness, anti-anxiety medications or antidepressants may be recommended. These medications alter brain chemistry to reduce anxiety and promote calm. Always take medications under the guidance of a healthcare professional. Never self-medicate or alter your regimen without consulting your doctor. Section 4. Complementary therapies. Exploring alternative avenues. Complementary therapies can offer additional support for lightheadedness, addressing both physical and emotional aspects. Vestibular rehabilitation improves balance and coordination by retraining the brain and inner ear. Customized exercises help your body adapt to changes in head position, reducing dizziness. Acupuncture, rooted in traditional Chinese medicine, can alleviate dizziness and improve balance. It stimulates energy flow and promotes natural healing. Stress management techniques like yoga and meditation can also help manage lightheadedness. Always discuss complementary therapies with your doctor to ensure they fit your treatment plan. Section 1. Reclaiming your equilibrium, key takeaways. Lightheadedness, that fleeting sensation of dizziness or unsteadiness, is a common human experience, often as harmless as it is unsettling. Understanding its potential causes, recognizing its warning signs, and knowing when to seek professional guidance can empower you to navigate those dizzy spells with greater confidence and reclaim your equilibrium. Remember, your body is a remarkable symphony of interconnected systems, each playing a vital role in maintaining your overall health and well-being. When one instrument falls out of tune, the harmony of the entire orchestra can be affected. Lightheadedness, in many cases, serves as a gentle nudge from your body, a signal that something within this intricate symphony requires attention. By listening attentively to these subtle cues, identifying the root cause of your dizziness, and adopting a proactive approach to treatment and prevention, you can restore balance to your internal orchestra and regain that sense of groundedness in your daily life. Whether it's staying hydrated, making dietary adjustments, incorporating regular exercise, or exploring complementary therapies, the path to reclaiming your equilibrium often lies in making conscious choices that support your body's natural healing abilities. Section 2. When to seek help. Listening to your body's alarms. While most episodes of lightheadedness are benign and self-limiting, certain red flags warrant prompt medical attention. Just as a smoke alarm alerts you to potential danger, these warning signs should never be ignored, as they might indicate a more serious underlying condition requiring immediate medical intervention. If your lightheadedness is accompanied by chest pain, shortness of breath, or an irregular heartbeat, seek emergency medical care immediately. These symptoms could signal a heart attack or other cardiovascular event requiring urgent treatment. Similarly, if your dizziness is accompanied by sudden weakness or numbness on one side of your body, difficulty speaking, or a sudden severe headache, call 911 or your local emergency number right away. These symptoms could indicate a stroke, a life-threatening condition that requires prompt medical attention to minimize brain damage. If your lightheadedness is persistent, recurrent, or interferes with your daily activities, don't hesitate to schedule an appointment with your doctor. Even if your symptoms don't seem severe, a medical evaluation can help rule out any underlying medical conditions and provide peace of mind. Remember, your health is your most valuable asset. By listening attentively to your body's signals, seeking timely medical advice when needed, and taking proactive steps to manage your health, you're making a wise investment in your present and future well-being.